Hello, I'm Dr. Preston Smith from University Pediatric Urology. I'd like to talk to you now about the post-surgical care of circumcisions, circumcision revisions, and recircumcisions. I'm not going to talk about the newborn circumcisions that are commonly done in our office. I'm talking about those that are done at the hospital or the surgery center. It may be performed by me or one of my associates. Generally speaking, circumcisions are elective because they have a very low risk of complications. The biggest problem with a circumcision is the penis has a lot of blood supply, and that blood supply almost always will make the penis look very ugly, very bruised, very swollen, maybe even blistery, and very abnormal after a circumcision or a recircumcision. So that's a normal expectation. Probably that's the number one issue that parents have to deal with at home, is maybe a little temporary bleeding on the first day or the first night of the surgery. So children that are in a diaper, so those less than a couple years of age, the best way to hold pressure and stop that bleeding is with a pressure diaper. And either I, one of my associates, or the surgery center, or even the hospital may explain to you how to do that. But it's real easy. Basically, you're putting the penis up on the tummy. You're taking like 3 wash rags all folded up so you have a thick pile. You put it on top of the penis, and then you put the diaper on as tight as you can. Even if you have to put the Velcro kind of like in a V down, or you have to tape it and reinforce it, and then you just ignore it for about an hour. And that'll push the penis against the tummy, and that should stop any bleeding you have. You may have to repeat that once or twice, but almost always that'll stop any bleeding. And of course, that's just if it's got a steady drip. A little ooze is nothing to worry about. Now, the older children, they're not in diapers. The best way to get pressure is for them to lay on it. So you can put a big pile of towels, rags on the floor, maybe in front of the TV, and have them lay on it, kind of humped up on it, and just have them lay there and watch TV for an hour. And that would, again, smash their penis against their tummy and should stop any bleeding you have. Otherwise, there's really no specific care. Some of our providers like Vaseline. I tend to be a minimalist. I like really not much of anything. In fact, getting air to the surgery site, to the circumcision site, is a very good thing because that'll make it dry out, scab, and heal quicker than always being in a wet, soggy diaper or gooped up with Vaseline. But if you're instructed to do so, it's fine to use Vaseline. Just understand that that's not really necessary. The biggest issue probably also with circumcisions is that even though they're, quote, in the dirty part of the body, we don't really need you to clean it, because the more you're wiping and scrubbing and cleaning it, the more likely you are to pull our stitches apart, and basically you may get a less pretty outcome, or it may just take longer to heal. So I prefer for the first week or so that you just kind of let water run over it like a shower, and you just lightly pat it. But you don't be rubbing and scrubbing. Even if little babies poop all over it, the chance of infection is much less than 1%. So again, keeping it simple is easy. So we like air. We like just basically water running over it, light patting, no scrubbing, no special soaps. If you want to use Vaseline, that's fine. Stopping the bleeding is the only thing that you really care about with pressure. So it's either a pressure diaper in the younger children or laying on it in the older children. Now, nowadays we're trying to stop using narcotics for pain management. Your child will get pain medicine at the time of surgery and even probably a dose before you leave the hospital or the surgery center. Most times now we're just encouraging families to use Tylenol or Motrin afterwards. The older kids, we may give you a few doses of the hydrocodone prescription, but that'll be up to you to fill it, but we gently kind of discourage you from using it. In other words, we try to avoid the narcotic pain medicine and just use Tylenol or Motrin. Lastly, I want to tell you is that calling us about swelling, redness, blueness, blisters, really doesn't help us, because it's illegal for us to get photos or anything over the phone, and so we can't really tell by talking to you how swollen and how bloody or how bruised, or if there was some yellow gunk or something that you were concerned about. So if you have concerns, you just call our office during the day and come in and see us right away. We're always available. But calling us about those type of issues probably is not going to go very far, and we're just going to say you need to come see us. We don't really like emergency rooms and primary cares to see these, because they tend to sometimes worry about it. They sometimes think it's infected when we probably don't. So I know some of you are far away, but if it is really a concern, I would ask that you just come see us, and it'll save money and time, And of course, we're responsible, so we should see any issues that our patients or their families have. Normally, we do not ask for our circumcisions or recircumcisions or revisions to come back and see us. That's totally elective and up to you. Of course, we're always responsible for what we do, so you can come see us at any time. If you're not happy, feel like it's bleeding too much, too swollen, just come see us. Otherwise, we'll assume no news is good news. And there might even be a little separation of the circumcision site, a little where the skin separates. There's nothing we do about that. You can't run and sew it or glue it or tape it. It just needs to heal, and it should heal just fine. Again, remember, we would not do circumcision type procedures if there was much risk or much care or much medical concern. So you want to just kind of make sure that it's not bleeding too much, and then you want to be patient because it might take a week or 2 or 3 for the bruising, swelling, and all that to go away to know whether you're happy. But almost all of our patients are. And so we probably won't see each other again, but if we do, we'll look forward to it. So again, thank you for trusting us with the care of your patient. And if you have any specific concerns, ask the provider who does the procedure, but they'll mostly probably agree with what's in this video. Have a good day. Thank you.